Very good afternoon and welcome once again to our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Sean O'Donnell. He's a Program Administrator, Public Health, Preparedness, and Emergency Preparedness and Response for the Department of Health and Human Services. Reporters, you should all have permission to record. If you do not, please request it on the chat. Mr. County Executive, I toss it to you. Good afternoon.
All right, good afternoon. Thank you everybody for joining us today. I'm going to start with an update on something that was just announced by Montgomery County Police Department. A man has been arrested in the 1971 murder of a Montgomery County law enforcement officer. Montgomery County Special Deputy Sheriff Captain James Tappan Hall was killed while working as a part-time security guard at the Manor Country Club. He was reportedly shot in the head during a break-in. Hall's murder was the only law enforcement death in this county that had remained unsolved. That is until today. After more than 50 years since his death, his family finally has some answers to questions about it. I wanted to commend Montgomery County Police Department for not giving up on the case and other cases like this, and all families of murder victims certainly deserve justice. And our thoughts and sympathies remain with the Hall family for their loss. Captain Hall will be remembered and honored for his service and sacrifice, and we're all glad this was finally resolved and the family can have some closure. On the public safety update, I want to commend our police, health, human services, recreation departments, along with our regional service centers for their efforts over the summer to address crime and violence in the community. Although we sadly had a homicide in Rockville over the holiday weekend, it was the first homicide since June and only the second in nearly 4 months. Additionally, we had no homicides in the Silver Spring district this year after a major emphasis was put on this area that started last fall. A new police recruit class started last week with 30 cadets, and our last recruit class was only 18. So we're already seeing the positive impacts of our pay increases for officers. So I look forward to seeing more benefit from that as we begin the process, hopefully, of building our way out of the deficit officers that we've had. So hopefully more good news to come, but really good to see the numbers that we got for the recruit class this time. In Germantown, Wheaton, and Gaithersburg, and White Oak, our Summer of Peace efforts have been very successful and very well received. This effort was a human service focused collaboration with the community. We invested nearly $1 million in HHS and recreation programs targeted at youth services and activities. Our community partners at Identity and the Collaboration Council have been an incredible asset to our efforts here. And we're not declaring mission accomplished, but I am cautiously optimistic that our targeted community-based interventions are making a difference. And we'll continue to make those efforts to address the underlying causes of crime. It is important to be responsive and be available, but it's also for us to look at what are the causes that we see in our community and what can we do to be sure that we're addressing those causes at the root level. On the COVID update, school's back, Labor Day is behind us, but I want to take a moment to thank everybody who came to the holiday parades in Kensington and Gaithersburg Monday. It was really great to see so much enthusiasm out there and families enjoying, this wonderful aspect of our community. There were a lot of people I got to see. People were clearly very happy to be back, and I'm really glad to see the parades are back. At the Gaithersburg parade, I had this opportunity to talk with this year's Grand Marshal, Sue Polka. Sue complimented the county on our response to COVID, and I really did appreciate her comments. I often receive thanks for how serious we continue to address COVID and how hard we've worked to mitigate the risks. I'm equally grateful to our county employees, our businesses, and our nonprofits, the school system, and especially our residents for their continued vigilance, really paying attention to what's happening. And we hear a lot about how important our updates are in keeping people informed. The threat to the community from COVID remains low, with cases near 130 per 100,000 people. And hospitalizations continue to be on a downward trend. Admission cases for COVID in our hospitals are almost half of what they were at the most recent peak a few weeks ago. And it comes as the nation's on the verge of gaining a new protection from the virus ahead of the flu season in the form of a new vaccine that's targeted on the Omicron variant as well as the original strain. The new Pfizer and Moderna shots are recommended for anyone 12 and older if it's been at least 2 months since you had the last dose. Our county operated clinics have some doses and we expect to get more on a regular basis. We recommend appointments though, for our supply is limited at this point. So go to www.govexmoco.com. The county is not being used by the state as the main distribution point for the county. So there are many other locations in the county, and you can visit Maryland's vaccine locator at https://coronavirus.maryland.gov/pages/vaccine. And that lists many locations, including pharmacies with available booster appointments. On the monkeypox front, monkeypox or MPX is still considered to be in the outbreak stage in the US. More than 500 cases have been identified in Maryland, 62 of which are in Montgomery County. Far more people have now been vaccinated for MPX. Close to 3,500 doses have been administered across the state. And here in Montgomery County, we're working our way through our pre-registration list. This upcoming Monday, we're going to host our second virtual town hall on monkeypox for the Latino community, and it will be held from 6 to 7:30 p.m. It also is streamed live on the county's Spanish Facebook page, Espanol Facebook page. It will also air on Montgomery County Cable. If you want your questions answered, please make sure to register through the special link you can find at montgomerycountymd.gov/MPX. The state's data dashboard on MPX shows us that more than 90% of the victims are men. The most common form of transmission is intense skin-to-skin contact with someone who's been infected. Pimple-like rashes and lesions on your skin are signs that you could be sick and contagious. So if you notice these, please get tested and follow the doctor's orders so you can keep everybody around you safe. September is National Suicide Prevention Month, and suicide is a very difficult issue to talk about, let alone prevent. Montgomery County families have an important tool at their disposal, though, to help prevent suicides. The county, along with our partners at Every Mind and MCPS, created BeTheOne.org website in 2017. The idea of Be the One is to be the person to ask, to keep people safe, to be there when they need somebody, to help them connect to resources they need, and to follow up to make sure that if you've had a conversation and suggested that somebody should take steps to make themselves safer, make sure they've done that. The website takes users through a series of 5 steps meant to help identify someone who may be struggling with fear and embarrassment. Ask, keep them safe, be there for them, help them connect, and then follow up. Many times, those on the verge of taking their own lives won't reach out for help and tend to isolate themselves. That's why it's important to take extra steps to identify warning signs and be blunt with the questions that you ask. For example, are you thinking about killing yourself? How much are you drinking and how much are you using drugs? The answers may be hard to hear, but they can help someone and keep us in the end from losing a life that doesn't have to be lost. Recently, today, the website wallethub.com released its 2022 most and least ethnically diverse cities in the United States. 5 Montgomery County cities were ranked in the top 10. Germantown was 2nd, Gaithersburg was 3rd, Silver Spring was 4th, and Roxville was 10th. Our county's richness of vibrancy and character is in large part based in our diversity. Last weekend, I enjoyed the Ethiopian Festival in Silver Spring. This weekend, we have the Festival Salvadoreño at the County Fairgrounds, celebrating El Salvador's Independence Day. And later this month, we have the annual Pan-African Festival, or PANAFest, returning to Silver Spring. But our diversity means more than incredible festivals. It means that in our schools, neighborhoods, and throughout the county, friends, neighbors, kids, co-workers get to know and learn about traditions and values from all over the world. As of 2020, 32.2% of Montgomery County residents were born outside of the county. The national average is only 13.5. Our diversity is one of the attributes I like most about this county. I believe that this diversity actually enriches our economic development, education, and communities. So find something interesting to do over the next couple of weeks, explore what's going on around us, and take advantage of being able to look at different traditions, eat different foods, and talk to different people. At this time, I'd like to bring Sean O'Donnell from our Montgomery County Health and Human Services Department to talk more about our ongoing health threats, and then we're going to take your questions. So, Sean, it's all yours.
Thank you very much, Mr. County Executive. So you should all be able to see the presentation at this point. The first thing I want to do is just offer a few points about the updated boosters that have come out. We have begun receiving them in the county, not only the health department, but a number of other partners around the county. The main new thing about this is a bivalent booster. It includes protection not only against what they call the ancestral version of COVID, the original version of COVID, but against the Omicron variants, particularly the BA4 and BA5, which were incorporated into this booster. So it offers a broader range of protections. The other thing that's been updated is who's eligible to receive it. Currently, anyone 12 and older who has completed their primary series or has gotten a booster shot at least 2 months previously. And that's for the Pfizer. For the Moderna version, it's approved for anyone 18 or older who has completed their primary series or a booster shot at least 2 months prior. So all of these groups will be eligible for at least one more booster, the bivalent booster. The under 12 population is still using the monovalent boosters. They have not yet been approved by FDA, the bivalent, to be given as a booster for those age groups, but perhaps down the line. Again, they're recommending that these are the best protections against COVID. So we have additionally, all of the vaccine that is being given out now as boosters to those age groups is the bivalent booster. We've no longer been recommended to give the monovalent booster, the previous booster dose, to 12 and over. So we began receiving vaccine on Friday. We received a small amount of Moderna on Friday, a slightly larger amount of Pfizer yesterday, and we began giving that out through our clinics starting yesterday. Again, because of the limited amount that came to us, we've been looking at the vaccines.gov, the national search engine, the Maryland search engine, as well, as you can see on this page. And there's a broad number. This was a search for those specific bivalent boosters. There's a broad number of sites, mostly pharmacies, some urgent care, and then the sites that the county is operating. We have a number of doses there. We're recommending appointments right now because of the limited number of doses we have. As you can see, looking at the CDC site, again, a large number of locations are showing those two boosters, and you can select the specific type of vaccine you're looking for. Looking at the updated variant proportions, we are still seeing predominantly BA4 and BA5 present. BA4.6 is a sub variant of BA4. Predominantly are the cases now, but with those case rates falling, we're really seeing a lot fewer cases. As the county executive mentioned, our hospital rates have come down. People with COVID, we've seen mostly a decrease in the ICU numbers so far, and at our alternate care site. So we're still monitoring these, of course, but we're seeing less severe illness as well as fewer cases. Moving on to MPX or monkeypox, wanted to share with you some data that is now available through the CDC's website. This is the time series of MPX cases. As you can see, there's a little variance weekly with a spike of cases reported on Monday, likely because there's more places that can test during the week than on the weekend. But you see the number of cases being reported is gradually has been receding over the last week or two. We are still within Maryland, we're still seeing our numbers go up. However, again, it may appear to be slowing a little bit, but we're heartened to see nationally that some of this is coming down, and it may be effects from both vaccinations and from the awareness of this new disease spreading. The numbers that we're seeing now in across the country, there were 2,316 new cases identified since the previous week across the country, 70 new cases in Maryland. So that is now about 554 as of the other day. Again, Maryland now has a dashboard that is updated weekly to show case numbers in counties where at least 10 cases exist. And again, in Montgomery County, we are seeing that we are at 62 cases. We are also, of course, tracking the demographics across the state and in county. And again, the CDC is now publishing the vaccine administration data, and you can see there was sort of a peak a few weeks back of vaccine that had gone out to that initial wave. Lots of second doses now are occurring. In Montgomery County, we're still continuing to do lots of first doses and working to expand who can get these doses. As of yesterday, we have now invited all the individuals who qualified for the extended post-exposure profile. So these are people who were likely exposed at some point over the last 14 days. So they have all received at least one invitation to a clinic. We're working to make sure they can all get scheduled as their availability is. We continue to have people sign up through the pre-registration list, and we're talking with our state partners about the timing to be able to expand to the next qualifications of individuals. The state has a pre-registration list that went live last week as well, and we'll be working with them if they get people who register through their site to make sure that we're also offering appointments to those groups. We did receive some more vaccine last week, and so that, again, that allows us to expand what we're doing here in the county and make sure that we can give second doses when those are due. And then finally, as the county executive mentioned, we will have a town hall for Spanish speakers next Monday, and we will continue to update things on our website. And we're also, because we're doing right now most of these vaccinations at our Dennis Avenue Health Clinic, we're able to offer additional information and wraparound services that we already offer at Dennis Avenue. So those were our public health updates, and I'd like to turn it back over to Lorna at this time.
Thank you, Mr. O'Donnell and Mr. County Executive. Reporters, remember to use the chat to ask permission to pose your questions. I don't see any requests quite yet on the chat, so I'm going to give you a minute. Any questions, reporters? Members of the media? No questions today for the county executive and or Mr. O'Donnell regarding the topics today and the public health update?
Hi, I have a question. This is Ismar.
Thank you, Ismar. Good afternoon.
Good
Ismar
afternoon.
Ventura, Univision DC, Univision.
I just have a quick question. I know we talked a little bit about the numbers in terms of, monkeypox in Maryland, how there's this chart. And I do see that there is some, correct me if I'm wrong, some Hispanics or Latino cases. And I know that there's that information session coming up on Monday. But what would be the message maybe to the Latino community? I know with COVID, in my experience, there was a little bit of a misconception about how, the virus affected them and perhaps, what resources were immediately available. I'm trying to see, I'm working on a future report about understanding what this is and how it can affect you and your family and how to prevent it.
Thank you for that question. And it is something that we've seen with other diseases, and we've seen with COVID. One of the essential tasks when you have a new disease is getting the message out to all of our communities, and that includes in multiple languages for populations where English is not their primary language, and that includes through media that helps us get that message out. So that's one of the things we're trying to do now, is raise awareness of where the risk factors are for MPX. So far, we have seen the majority of the transmissions as were reported in men, and many of those transmissions have happened with men who have sex with men, but it's certainly not limited to that. One of the important messages is anyone can get monkeypox if they're in skin contact. This has been a challenge of this, is we don't refer to this as a sexually transmitted disease, but people do come in skin-to-skin contact when they engage in those activities. And so there can be other activities though as well. We're concerned, of course, with when people have skin-to-skin contact with people they don't know, if they're at dance clubs or other places like that, those are possibilities for transmission. So we're just trying to raise awareness. Also, we're trying to raise awareness of how this is spread. It's not being spread on people who don't have symptoms. It's being spread on symptomatic individuals. So that also, it means that if you are having these types of symptoms, it can look like a pimple-like sore. If you're having these symptoms, please get checked out by a healthcare professional, either your personal healthcare provider or urgent care. They can do these screenings and they can do testing. So that's really the only time you can do testing, is when you have somebody who is symptomatic. But being aware of what the risk factors are and when to get tested. And then, of course, if that test comes back positive, the health department will be notified and we'll reach out and sort of do that contact tracing and try to find if there's more exposures. Unfortunately, and as the reason this is spreading is because it's moving a little bit faster than public health is able to identify the contacts. And so, but that as I said, we are starting to see the cases recede. So we're hoping that those tactics, along with the vaccinations, are helping to limit this. And so that's the final big message, is that we do have vaccine available. If so far we've been giving it to individuals who have been considered to very likely have been exposed recently based on behavior, based on the spread of MPX in this area. So those individuals are qualifying and getting vaccinated. It's a 2-dose shot separated by about 4 weeks. So those are the key messages. And of course, it is, as with many of these new public health challenges, we see the difficulty sometimes in getting messages to all of our population. So we appreciate the work you're doing, and we'll certainly have lots more detail and about questions folks may have on Monday's town hall.
Perfect. Thank you.
Thank you, Ismar. Yes, the town hall is on Monday at 6 p.m. and you can watch it live on Facebook Live, Montgomery County en Español. All right, Jeannie Bixby, Bethesda Beat, I see you put a question on the chat. Do you want to ask it, or do you want me to ask it?
I can ask it. It's just what I said. Hi, I'm Jeannie Bixby. I'm from Bethesda Beat. How many doses of the COVID bivalent vaccine does the county currently have, and how many do you think you're getting in the near future?
Thank you. So far, we've received about 1,100 doses between Pfizer and Moderna, much more Pfizer than Moderna. But I think part of that is the the interest at the state and federal level to get the vaccine in the hands of as many providers, as many pharmacies and urgent cares as possible. We still have lots of capacity to give out vaccine in Montgomery County. That's not necessarily true of all the health departments. And again, we're also doing a secondary mission, and as many health departments are, with getting out MPX vaccine. So the health department alone has gotten 1,100 so far, but we know lots of other folks in the county have gotten it. We've asked for additional quantities. I think we upped our request an additional 500 doses, a few weeks back. So we're still waiting for those to come in, and then Thursday is the day in the state that we can place our order for more vaccine, and we're certainly going to ask for a significant amount more. We do expect the demand to be there based on the utility of this vaccine and with the wider groups who can get it.
Is that good, Jenny? Any other questions?
That's all. Thank you so much.
Thank you. Next up, Pamela Lehigh, NBC4. Do you want to ask a question, or do you want me to ask a question that you placed on the chat, Pamela? All right, so the question is, how many doses of the new booster is Montgomery County getting?
I think that may be what I just answered. Again, it's so far we have 1,100. I think we've got another about 700 we've requested already, and we'll place an order tomorrow for a few thousand more doses.
Thank you. Heather Curtis, WMAL. You have questions for the county executive. Good afternoon, Heather. Heather, you here? You might need to.
Sorry about that. Can you hear me?
Yeah, on mute.
Sorry,
Okay.
I'm having a technological issue here. County Executive Elrich, I know you spoke about the diversity study. First, I'm wondering, were you surprised about this, that 4 of the 10 cities on that list were from our county? And also, if you could just elaborate a little bit on how being so diverse enriches economic development and education and such.
So I'll start, I guess, with the first one. I wasn't surprised at all because, there have been these annual reports for a number of years, and we've always had several cities that made that top 10 list in the counties, in the country. So we've kind of known this seems to be where we've landed. And, obviously some of the cities are smaller than others. So sometimes it's hard to make comparisons between, all cities, but in this case, they've made this comparison. So it's interesting. It benefits people in a lot of different ways. For one thing, we become increasingly international in the business world, and there are a lot of companies who look for people who are multilingual. And so we've got opportunities. We've got residents here who are multilingual. We have, a lot of folks who've come here in the sciences and in just any number of, technical fields. Who occupy those spaces, and they bring with them multiple languages, and they're able to communicate and work with people. And so from an economic development perspective, being seen by other people as a place where you can come, operate, be understood, is all to our advantage. And to be culturally accepting, frankly, is to our advantage. There's a big difference between how people may get treated here and in some other parts of the country. And that makes a difference in where a person decides to put down roots and make a home. And I've seen a lot of that when I go talk to people around the community, different communities, when they tell us what this means. I think, diversity of language and education is good because it gives us a base for educating more of our own students in multiple languages. The United States has never been as far out in front as some other Western countries are, and having a population that acquires more than one language. And because we're serving multiple people with different languages here, I think we provide opportunities that are taken advantage of by our own residents as well. And I think having a multilingual community or, residents more generally in the county is a healthy thing for the county.
I just have one more follow-up, if I may. You said, County Executive, that in 2020, 32.2% of residents were born outside the county. Did you mean country, or is it just county?
Oh, I think we meant country.
Okay, thank you. I figured, but wanted to make sure.
Yes,
Thank you so much.
sorry about that.
No worries. Thank you.
Thank you, Heather. I do not see any more requests for questions from members of the media. Anybody else has any other question for our officials today? Going once? Going twice? All right. I think that's it for today. Thank you, everybody, for joining us. We'll see you again next week. Stay safe. Have a great afternoon.
Thank you all.
Bye-bye. Thank you all.